Good afternoon, everyone. Thank you for joining us. It is 2 o'clock, so we are going to go on ahead and get started. My name is Dr. Tina Lewandowski, and I'm the Director of Engagement here at the ADRC. Today, we have a presentation from Alicen Whitaker. She is a physical therapist and PhD candidate in the Rehabilitation Science Program at KUMC. She's interested in neurorehabilitation and recovery research. She started the DBT PhD in Dr. Sandra Billinger's Research in Exercise and Cardiovascular Health laboratory. She received a T32 training grant in Neurological and Rehabilitation training program led by Dr. Randy Nudo and led the treatment intervention for a multi-site randomized clinical trial studying moderate intensity exercise versus high intensity interval training to recover walking post-stroke. Her current research interests have evolved into studying cerebral vascular response to high intensity interval exercise in individuals post-stroke. She currently received a Predoctoral Fellowship Grant from the American Heart Association. So we're very excited to have you with us today, Alicen. Just a quick reminder, everyone, please keep your microphones on mute. And if you have questions during the presentation, you can type them in the chat. We will have time at the end of the presentation for Alicen to answer the questions at that time. As always, we'll also have the recording available within 24 hours. Alicen, I'm going to go on ahead and turn it over to you.
All right, perfect. Thank you so much for the introduction. And thank you so much for inviting me to present today. I'm very excited to share our work and talk with everyone a little bit about brain blood flow and exercise. So I know a few weeks ago, you actually had a talk about brain blood flow from one of the postdocs in our lab called, her name is Dr. Stacy Aaron. And so my talk today is kind of a continuation of her talk, looking at brain blood flow, but in a specific type of exercise called high intensity interval exercise. So I am actually a PhD candidate in the Rehabilitation Science Program, but I'm a physical therapist by training. And so I'm really interested in how exercise affects the brain and how we can kind of optimize brain blood flow with exercise. So I'll get started here. So everybody kind of talks about exercise and how it's good for all types of health. So exercise really is medicine, and really increasing fitness levels with exercise has been shown to improve vascular health, not only in our arms and legs and heart, but also within our brain. And it's been shown that with increased fitness, we actually see a decreased risk of stroke and dementia, increased cognitive function, and we actually see an increase in resting blood flow. So that is kind of my line of research that I'm really interested in, is looking at this resting cerebral blood flow and kind of how it changes with exercise and with fitness. So a little bit of background for individuals who might not have heard the talk a few weeks ago. So this is our kind of methodologies of how we look at brain blood flow. So we have something called the transcranial Doppler ultrasound. So it's two non-invasive ultrasound probes that sit on the forehead area in the temporal window, and they use sound waves to measure the blood flow traveling within the middle cerebral artery. So you can see on the right of the picture kind of these waveforms of how we collect brain blood flow. And what's really interesting is we can collect this brain blood flow response as somebody is performing exercise. And one of the devices that we really like to use within our lab is called the NuStep recumbent stepper. So it's used a lot in physical therapy. It's kind of like a reclined bicycle in which you get to sit back in the chair, but rather than doing kind of a bicycle pattern, you step back and forth on this recumbent stepper. And so that's what we use a lot within our exercise studies to look at how blood flow responds to exercise. So a little bit of background of how brain blood flow does respond. So we know that brain blood flow, it responds to metabolism. So as individuals start to exercise, brain blood flow goes up to help supply oxygen and nutrients to the brain. It also responds to blood pressure. So as we start to exercise, our heart starts pumping, our heart rate increases, and our blood pressure increases. And so that also translates into a higher flow to the brain. The brain is also very responsive to oxygen and to carbon dioxide. So it's really responsive to how we're breathing, how we're getting oxygen, and then what we're breathing out as well. So we have looked at this brain blood flow response to exercise, specifically moderate intensity. So this is a brisk type of exercise where we do 6 minutes at brisk intensity. So you can kind of see here on the y-axis, so that's this left side, we're looking at the middle cerebral artery blood flow. And then you can see on this x-axis that this is a response in time. So, and then this dashed line here is the onset of exercise. So to the left of this dashed line, this is at rest. Before people start exercising, this is what brain blood flow is while they're just sitting there. And then when we start to exercise, path to the right of this dashed line, you can see how brain blood flow responds, and it starts to increase with that brisk intensity exercise. And so we looked at this in 11 young adults and 11 older adults. And what we saw is that with exercise, there's a slightly lower response in older adults compared to younger adults. And this is kind of a natural response with aging. But then when we looked at individuals across the age spectrum, what we really realized was that fitness does matter with the cerebral blood flow response. So here you can see this change in blood flow that occurs with exercise. And then here on the x-axis is somebody's fitness level. So it's basically saying that the more fit you are, so you're performing exercise regularly, you have an increased physical fitness, we're seeing a greater response within brain blood flow during exercise. And that's across the aging spectrum, both in young and older adults. So part of my line of research as a physical therapist is I'm really interested in what happens to the brain in somebody who's had an injury to their brain, such as an individual after stroke. And so while we were performing this study, we actually had an individual come in who had had a stroke. And so we were able to look at how their brain blood flow responded in both the affected side of their brain that had the stroke, and then their non-affected side that had not had the stroke. And they came in 3 months after they had had their stroke. And so similar to the graph we saw before, to the left of this dashed line is at rest. And then to the right of the dashed line is their response to this brisk intensity exercise. And this individual had a left-sided stroke. So their stroke affected artery is the open dots. And then the non-affected artery is the closed dots, so the solid dots. And what we saw is with the onset of exercise, with this brisk intensity exercise, they actually had a lower response within their stroke affected side. So after their stroke, they had about a 50% reduction in blood flow to that side of their brain during this brisk intensity exercise. And then we had this individual come back at 6 months after their stroke, so about 3 months later. And I will mention this person was very active before they had their stroke. This person was actually a cyclist, and so they were doing a lot of bicycling prior to their stroke. But 6 months after their stroke, we started to get into the winter time. So they're a little bit less active at the 6 months period. And so what we actually saw is with less physical activity that they were performing, they actually had a decrease in this blood flow response to exercise in both their stroke affected hemisphere and their non-affected hemisphere. And that went down by about 10% with less physical activity. And so unfortunately, we encountered this individual again a year later because they had had another stroke. And so we were actually able to see what occurred within the artery before they had their stroke. So we were able to see the right side and the left side. So both sides now had a stroke. And so you can see that here on the bottom left corner. You can see that now both sides of the brain have had a stroke. And you see a very blunted response to exercise and brain blood flow in both the right and left side. And then we had them come in again at 6 months after that second stroke. They unfortunately were pretty sedentary, weren't really exercising much. And we saw once again this blunted response. And compared to their first visit with us, this went down by about 67% and 80% in the other hemisphere. So you can really see here, once an individual has had a stroke, we're seeing kind of a reduced response in blood flow, but also with physical activity, what can happen with that cerebrovascular response to this brisk intensity exercise. So what I just talked about there was this kind of brisk intensity, so moderate intensity exercise that we did for 6 minutes. It was kind of at this continuous heart rate. But what I want to talk about now is this new type of exercise that's being implemented for individuals with stroke called high intensity interval exercise. And this is being used a lot in physical therapy for people who've had a stroke, and also for individuals across the aging spectrum to look at improving vascular health, improving heart health, and also improving walking outcomes. So increasing walking speed and walking endurance. So this high intensity interval exercise, kind of how it's different from the typical brisk intensity exercise that people do. So this high intensity interval exercise involves repetitive intervals of about 1 minute of a high intensity exercise. So we're really getting heart rate and blood pressure up there. We're really, you feel like you're doing kind of a heavy intensity for 1 minute. And then you have a 1 minute recovery where we come down to a light intensity. You get kind of a rest break. You let your heart rate, your blood pressure come down. And then we continue switching every minute between this heavy intensity and this light intensity for the duration of that exercise bout. So they do 10 minutes of this high intensity interval exercise, and every minute it's switching between this high intensity and this light intensity. And what this has been shown is that with this high intensity interval exercise, you actually can do a shorter total amount of time exercising and still see increases in fitness levels. You can still see improvements in vascular health, decreases in blood pressure, weight loss. And it's also been reported that individuals, although it's physically demanding because you're really getting into that high intensity, heavy intensity exercise, because it's separated by these rest breaks, it actually has been shown to elicit greater enjoyment. And so I had the opportunity to work with this high intensity interval exercise in individuals with stroke. But what I was really interested is what's happening in the brain when we do this type of exercise, because we're asking people to go really, really high intensity and then light intensity. So we're having kind of these intervals, and we don't know what happens to brain blood flow when we do this type of interval pattern. So the objective of this study is to characterize this blood flow response. It's called the middle cerebral artery blood velocity, or MCAV, during just a single bout, so just one time exercising of this high intensity interval exercise in individuals who've had a stroke compared to their age and sex match controls. And what we hypothesize is that after a stroke, these individuals would have a decreased brain blood flow response compared to their age and sex match controls. And so here's a little bit of an idea of what this study kind of looks like. So we start out by measuring brain blood flow for 5 minutes while somebody just rests there, just resting in a seated position. And then we have them do 10 minutes of this high intensity interval exercise. So we start with light intensity for 1 minute. And then the second minute, we go to high intensity, where they're doing kind of this heavy intensity exercise. Heart rate's really getting up into the high intensity zones, blood pressure is increasing. And then the third minute, we come back to a light intensity. So they can have a little bit of a rest break where heart rate and blood pressure comes down. And then the fourth minute, we go back up to high intensity, and we keep switching between high and low intensity every minute for 10 minutes. And then right after exercise, we have them do a 2-minute cool down, and then we have them rest again so that we can look at recovery of blood flow after exercise and how that may potentially change in somebody who's had a stroke. So before we did this in individuals who'd had a stroke, we wanted to look at what happens in healthy young adults. So we had 24 young healthy adults come in, and we looked at how brain blood flow responds to this high intensity interval exercise. This y-axis is brain blood flow, the middle cerebral artery blood velocity, and then, sorry, the y-axis is this brain blood flow, and then the x-axis is the time points. So the first time point is this light intensity, the second dot is the high intensity, third dot, once again, we're coming back to light intensity, and it continues switching throughout the entirety of that exercise bout. And then this dashed line here, this is their baseline. So this is what it was before they started exercising at rest. What was their brain blood flow before they started exercising? So as we can see in young healthy adults, you start to get an increase in brain blood flow as people start to exercise. And then it peaks at about the third minute of exercise. And then it starts to decrease during high intensity. And then it rebounds or comes back up during the rest break. So it starts decreasing during high intensity. And then once again, it increases during rest, decreases during high intensity, increases with rest. But overall, it starts going towards kind of their baseline resting blood flow during this exercise bout. So some of you may be wondering, well, why would brain blood flow decrease during this high intensity, heavy type of exercise? So if you remember before, I said that the brain is very responsive to how we breathe. So when we start to do this high intensity exercise, we actually start to hyperventilate. So during high intensity, we start to hyperventilate, we're breathing out carbon dioxide, we're really working hard, and that actually makes the arteries in our brain start to constrict, and that will actually decrease brain blood flow within that artery. And so during high intensity, brain blood flow starts to decrease. And then when we have this rest break where we can kind of recover our breathing, we're not hyperventilating and breathing really quickly like we were during high intensity, those arteries can relax and that brain blood flow will increase again. So that's why we're seeing this decrease with high intensity and then increase with light intensity. So we're kind of seeing this interval pattern with brain blood flow. And so this is our preliminary results in 10 individuals who've had a stroke. So we're interested in looking at this in individuals who've had a stroke compared to their age and sex matched controls. This study is still ongoing. So these are just preliminary results of 10 individuals who have had a stroke. So once again, the y-axis here is their brain blood flow response. And then the x-axis is the time points. So it starts with light intensity, then high intensity, light intensity, and so on. And this dashed line here, once again, is their baseline. So before they started exercising, what was brain blood flow? So in the 10 individuals who've had a stroke, we see kind of the same pattern where brain blood flow starts to increase. And then it peaks around minute 3 and 4, and then it starts to decrease like we were seeing in the young healthy adults, but we don't see that same type of intervals that we were seeing in the young healthy adults. So although they were still doing this kind of high intensity, heavy intensity exercise, we aren't seeing kind of the arteries respond in that same way to the high intensity and the light intensity exercise. So this just shows that they were really getting into the high intensity, they were getting their heart rates into those zones, just like the young healthy adults. But we aren't seeing that same type of pattern within brain blood flow. So kind of the take-home message here, this high intensity interval training, it's becoming very popular right now. It started out being used actually by Olympic athletes, but it's starting to now be used in individuals across the aging spectrum. It's starting to be used in clinical populations. It actually started out in cardiovascular health, so cardiac rehab. A lot of the clinical populations were performing it in cardiac rehab, and now it's starting to be used for individuals with stroke. And it's been shown to improve walking and vascular health, but we really need to think about the brain and what's happening to the brain when we ask somebody to do this type of exercise. So take-home message related to brain blood flow and how it responds to exercise. I'll say physical fitness, being physically active, making sure that you're exercising the recommended dose of 150 minutes of that brisk intensity exercise per week will actually have an impact on how your brain responds to exercise. And also a take-home message is that with exercise, individuals after stroke may have a unique response compared to individuals who haven't had a stroke. Also, kind of this future line of research is that we need to start thinking about exercise for the brain. A lot of the times we think about exercise for strength and for balance, but we really need to start thinking about prescribing exercise for brain health. And kind of measuring how brain blood flow responds to this exercise, we may be able to tell what individuals have brain readiness to perform this high intensity interval exercise versus maybe individuals who don't have this brain readiness to perform high intensity interval exercise. So here are the acknowledgements. I'd like to thank the Reach Lab team, the American Heart Association, the T32 for their funding support, and also to the Alzheimer's Disease Research Center. We collaborate a lot with the ADRC, and I think that it's a very great program that does this weekly webinar series. And thank you very much for having me today.
Thank you, Alicen. We enjoyed your presentation. Fantastic. I'm going to turn it over now to the chat for any questions that we may have for Alicen. So if you have any questions, you would just go ahead and put those in the chat and then we will address them. Does anyone have any questions for Alicen?
Yes, would you once again tell us what's the difference between high intensity, that's the interval training, and then 20 minutes of cardio, and then the rest of 20-30 minutes of continuous cardio, and the rest, the difference between those two to the brain?
Yeah. So you asked what's the difference between this high intensity interval exercise and then what was the other type of exercise you asked about?
Regularly continuous 20 minutes or 30 minutes continual cardio exercise?
Yeah, definitely. So with the kind of brisk intensity exercise, continuous exercise that I talked about in the beginning is with brain blood flow, you kind of see this initial increase in brain blood flow. And then during the exercise bout, it kind of remains steady. Because heart rate and blood pressure all kind of remain steady, you kind of have this steady increase in brain blood flow when you do this brisk kind of continuous exercise where you don't have this type of interval pattern. But when you do this high intensity interval exercise, So because you're asking somebody to every minute, they switch between doing kind of a heavy intensity exercise, and then the next minute they have a rest break, and then the next minute they're doing a heavy intensity exercise. We see that the blood flow actually responds to these different intensities, and it starts to have an interval pattern where brain blood flow will decrease and then it'll increase, and then it'll decrease and then it'll increase. And we think that maybe this is responding to how kind of that intensity is. So it's following the pattern of heart rate and blood pressure. It's following the pattern of how we breathe. And so that's kind of the difference of how blood flow responds between those two type of exercises.
Okay, I understand that. So
Yeah.
which is more beneficial to the brain, the continuous one or interval?
Yeah, that's a very great question. So we've looked at this with just a single bout of exercise and have characterized this. And our next future plan actually is to look at how these two different types of exercise, when we ask somebody to do this for, say, 3 times a week for 12 weeks, how the brain responds to those different types of exercise that we ask somebody to do. So that is actually the next plan. I don't have those results for you, but that's the next study that we'll be doing. So if you are interested, be on the lookout because Dr. Billinger will hopefully be recruiting for this study soon. Yeah, thank you.
Thank you.
All right, Allison, we have quite a few questions in the chat here. It looks like Cheryl says, how do you determine if an exercise is high intensity?
Yeah, so the way that we look at high intensity is we actually do an exercise test on that recumbent stepper. And we look at how the heart rate responds to this exercise test. And then we can look at kind of what intensity based on heart rate to get these individuals into that high intensity. So kind of the heart rate that we use is we do 220 minus your age, and that's kind of your age predicted maximal heart rate. And then you take that times your intensity. So we usually say that a high intensity is about 60% of your age predicted maximal heart rate. But if you don't have a heart rate monitor, so that's how we specifically do the intensity to get into high intensity versus just kind of a brisk intensity, is we do heart rate. But if you don't have a heart rate monitor to kind of monitor what type of intensity of exercise, a good way is to think about your rating of perceived exertion. Okay, so that's thinking about how difficult do I think that this exercise is. So a brisk intensity, so when you start exercising, a brisk intensity, you really start to feel like your breathing has started to increase. You really feel like your heart rate has started to increase, but you're not breathing too hard that you can't hold a conversation. So you can still kind of talk to somebody as you're exercising, but you still feel like you're getting a good exercise in, that you're not doing kind of this light intensity where you don't really feel like your breathing has increased and you really don't feel like it's that difficult to do. So brisk intensity, you feel like you're starting to breathe a bit more heavy, but you can still hold a conversation. A high intensity, when you start thinking about how difficult you think that you're working, your breathing has really started to increase to the point where you can't really hold a conversation with somebody. So you can still talk with them, but it's usually in short kind of segments. And so kind of that high intensity is where you really feel like your breathing has increased and your heart rate has increased to the point that you can't really hold a conversation with anybody anymore. You're kind of focusing on exercising.
Thanks, Allison. We've got a couple other questions in the chat. Nancy says, do you have a theory as to why there seems to be a loss of variation in the cerebral blood flow pattern after stroke? And then we've got several others too.
Yeah, definitely. So I think so what we see in the young, healthy individuals, what we kind of hypothesize is happening is that the vessels themselves are reacting to the intensity and to breathing. So they're kind of getting bigger and getting smaller depending on the intensity that we're asking the individual to do. And we think that potentially after stroke, potentially due to kind of the underlying vascular health of these individuals, their vessels may not be responding in that same way that we kind of see this interval pattern. So that's kind of our hypothesis of what exactly is happening. We can't directly measure that, and we didn't directly measure that in this study. That's what we think is happening, is potentially the vessels aren't responding in the same way. They're not getting smaller and getting bigger like they do with the healthy young adults.
Thank you. And we are a little bit over time, so I understand if anyone needs to hop off, but we do have some other questions here in the chat. There have been questions about how often during the week do we need to engage in HIIT? What's the name of your HIIT study? Let's see. A question here, my Apple Watch does not register my heart rate until class is almost over. What do we do if we're still wearing a mask while we're exercising? So what are some of your responses to kind of that barrage of questions?
Yeah, so if your Apple Watch doesn't do heart rate, I would do that rating of perceived exertion. So think about how you're feeling as you're exercising. See if you can still hold a conversation with somebody as you're exercising. And that kind of tells you whether you're working at a brisk intensity or a high intensity. Our study, this specific study is called the Brain HIIT study, but Dr. Billinger's study that will be doing the 12 weeks of exercise will be called the FAST study. So hopefully we'll have some recruitment flyers out for that for anybody who's interested in our FAST study.
And then how often each week should people engage in HIIT?
Yes. So with brisk intensity, the thought is to do 150 minutes of kind of this brisk intensity. But when you do kind of this vigorous intensity or this high intensity, the recommendation is 75 minutes per week. And also to have a rest break between the days that you do this HIIT. So if you do it on a Monday, you want to allow at least 24 to 48 hours before you do it again. So maybe do it on a Wednesday or a Thursday.
Great. And it looks like we have another question in here. Is there a point at which it becomes negative, say 80, 90% of the max heart?
So we don't know that quite yet with the brain blood flow response. The heart rates that we've gotten our individuals into have been about 75%. I will say that with our study, we stay below the 85% of their age predicted heart rate max, because if you go above 85%, usually with individuals with stroke, you need medical clearance, a kind of a stress test where they look at your heart rate and how it responds in these really high intensities. So the heart rate that we're kind of getting into is below this 85%.
And then I think thank you. I think there was another question here. Say again the formula, 220-age. What was that?
Yeah. So your age predicted maximal heart rate is 220 minus your age. So that's kind of the predicted of how high your heart rate can get up to. And so usually you take 220 minus your age, and then usually 60% is right around that high intensity. So you take 220 minus your age, get your answer, and then take that times 0.6. And that usually tells you your heart rate for around high intensity.
Perfect. All right. Any other questions I missed? Okay, well, thank you so much for your presentation today. Just want to let everyone know that we will have another weekly webinar next Thursday at 2 o'clock. And there's more information about the presentation on our website, and you can always check out our My Alliance Monday email. or visit us at the kualzheimers.org website. This recording, if you want to go back and take a look at it, will be available on our YouTube channel shortly, and you can navigate to that channel under our website under weekly webinars, or use the link in the reminder email. If you have any questions, feel free to email us at myalliance@kumc.edu. And thank you again, Alicen, and I hope everyone has a fantastic week. See you on Thursday.
This was great. Thank you very much.
Thank you.